everyone to today's town hall event, HIV is not a crime. I'm Sunny Hostin, and I will be your moderator for today. And I am thrilled to be here. I want to encourage the audience to submit your questions in the comments section below, and we will try to address as many as possible at the end of the broadcast. Also, please let us know where you are visiting from. This is an issue that affects more than 30 states across the country, so the chances are good that you can do something to help reform HIV laws in your own state. Before we begin, I want to acknowledge and thank the Elizabeth Taylor AIDS Foundation for making today's event possible and for leading the campaign, The Charge, to modernize discriminatory HIV laws. Elizabeth Taylor worked tirelessly throughout the 1980s when the AIDS crisis was fueled by fear, not facts. In 1991, she founded the Elizabeth Taylor AIDS Foundation to fulfill her desire to see an AIDS-free world. Elizabeth spent her life fighting for marginalized communities around the globe. And now her foundation is continuing that legacy by tackling the latest barrier in the AIDS fight: outdated laws that discriminate against people living with HIV. Like Elizabeth, our panelists today have dedicated their lives to social justice. They represent some of the nation's top experts on HIV decriminalization, and I am so very honored to welcome them all today to this discussion. Robert Suttle, who was incarcerated as a result of his HIV status and has since become an advocate for reform. Douglas Brooks, who is here representing Gilead Sciences as their Executive Director of Community Education. Cecilia Chung from the Transgender Law Center, where she directs the center's strategic initiative. And Rick Chavez Zabur, I hope I pronounced that correctly, who is the Executive Director of Equality California. Now, we all know this is a complex issue that is just not frequently talked about in mainstream criminal justice reform, and that is a shame, but it's a conversation that needs to happen. The laws are outdated, and the repercussions are disproportionate for those affected. As we learn in the next hour, this is also an issue that has very real consequences to public health. Fear of persecution prevents people still from getting tested and treated. Given the recent pandemic and the current movement for racial justice, there is no better time to be talking about how we can do better to protect our communities. So let's begin. Robert Suttle is our first guest, and he is no stranger to this issue because he lived it. He is a recognized HIV social justice leader, social justice educator, and advisor on the HIV Justice Network's Global Advisory Panel. Welcome, Robert Suttle. Thank you so much for being here. Now, Robert, you just exemplify why we are here today. And let me ask you this. You were sent to prison because of your HIV status, and honestly, I just can't believe that. Can you please take a few minutes to share your story?
Yeah, absolutely. I was diagnosed with HIV back in 2003. Didn't know much about living with HIV. One thing those who are living with HIV would understand that when you're given that diagnosis, you're not automatically given the skills to negotiate how to disclose your HIV status. And so I was told that I could go on and live a healthy life, and that is what I did. I had 2 months before I was graduating from college. Like, I found out in October, then I graduated in December. And so my life was about to change as I was, becoming a young adult and moving out into the professional world. But I had to, address the fact that I was living with HIV. And so it was a really life-changing experience for me, one that many people, again, living with HIV would understand the emotions and the feelings that you go through around it. But I had plans. I had plans for my life. I graduated from college. So, I was feeling pretty optimistic despite learning this news. And so fast forward 5 years to address, how I ended up going to prison. again, negotiating how to disclose your status to someone, to anybody, is never an easy thing. And the only way to really learn it is through trial and error, really. Disclosing it to family or friends or whoever you can, whenever you can. It's not safe for people to disclose their status, and so it's really up to that individual to determine when they feel comfortable sharing their status, regardless of how society thinks that we should be disclosing at any and all times. But it's not legally safe to do that. And so I met someone that I was casually in a relationship with, a sexual relationship, someone that I didn't know very well. But, you know, as a black gay man living in the South, you know, us connecting with each other, a sense of community, a sense of belonging, and wanting to establish a relationship, you take a chance to see if it's going to work with someone. But unfortunately, that relationship was pretty contentious in that we didn't always see eye to eye, just in general. You know, it wasn't contentious around my status, at least not at the beginning, but just we didn't see eye to eye. And so as a result of that relationship ending, my HIV status came back into play by a mutual friend that I had disclosed my status to prior. As a result, I was arrested. He had pressed charges against me. I was arrested at work on my job. I was arrested in front of my coworkers. And as a result, I had to go to many hearings, and eventually I was convicted in 2009, and I had to do 6 months in prison.
Well, it's one thing to experience the burden of these unjust laws. It's another thing to become a lifelong advocate, right, and an activist, and just putting yourself out there like that. Is there a particular moment when you knew, I've got to fight, I got to fight for justice? Because I think there are people out there that want to help, and they want the inspiration to do so. What was your moment?
You know, my moment for me, because I had 6 months to sit in prison and think about what I was experiencing. I had never heard of HIV criminalization laws in my life. I mean, it's a lot to adjust when you're living with HIV and just adjusting to life, and then to be unaware of laws and how you can become criminally liable. It's very unclear. You know, it's the worst thing that anybody living with HIV would want to experience. And so for me, I felt like my life was over. And so I had to really think hard about my future, because being black, being gay, being HIV positive and living in the South, you know, being a black man in America, there just seems to be no hope as to how to move forward or get beyond these barriers or these struggles. And so I remember being in prison and talking to a psychologist there, and he reminded me it's just like a wall, you know, a brick wall with the cylinders. He's like, your life, this experience is just one of those cylinders in the wall. It's not the whole wall. And so that really helped me see some things a little differently. And so as soon as I got out of prison, I don't know, I mean, I immediately went online and started reading about, or at least, I don't know, acclimating myself back to society, because a lot can change in terms of your habits and, after 180 days in prison. And I just ran across a blog that was speaking about the very thing that I had gone through, and I didn't know what it was called, but as I'm reading, I'm like, wow, this is what I experienced. I really felt this was an injustice for many people, being black, being gay, because the way that you're portrayed as if like you're really attempting to bring harm to someone is quite misleading. You know, this message about public safety is quite misleading as it relates to a person's HIV status. And I felt like it was important for me to use my voice to set the record straight, to bring awareness that the people that are impacted, people that are being sent to prison, are not folks that should be there. They're not people that should be held criminally liable when they've not created any harm. And this is simply based on a person's HIV status and nothing else, you know, about them. And so again, I felt like, what did I have to lose? I had lost my job, I lost my benefits, I lost everything, that I was right at the cusp of starting a new career. I was 29 years old, a time when a young person is looking to blossom, to get out there in the world and make something of themselves. And here I was facing prison, facing a criminal, felony conviction.
You know, what is striking to me is we're in the middle of a global health pandemic, and I think people need to think about, what if you were COVID positive, right? You tested COVID positive, and you were in a relationship with someone, and you gave them COVID, and you were put in jail for it. It's so similar. It's when you think about it in those terms, it would be criminal to imprison someone for infecting someone else with COVID. But what's also striking about this issue is its intersectionality, right? It's you're talking about, I think, an issue of public health, of stigma, marginalized communities, and one of criminal justice reform. And you've become a major advocate for criminal justice reform. And kudos to you for doing that. I salute you for that. How do you think changing these specific laws support the larger fight to improve our criminal justice system? Because I really believe that this type of law would be applied to other public health issues.
Well, I definitely think the HIV movement sets the path, to how to do this. With COVID, we don't know what it's going to happen the next few years as regards to it being considered criminal, or in the criminal code, if you will. However, people can be arrested for it and charged under, other general criminal statutes or charges. So we don't know how it's going to go. But I'm personally not interested in reforming criminal justice system, because the system is what it is. But what I am more interested in is supporting communities of people who are impacted, because we are the ones that are really out there suffering. We are the ones really out there experiencing the things that are happening firsthand by our criminal justice system. It is not a just system. It is a system founded on racism. It's a system founded on bigotry. And this is through years since policing started in America. And it has since evolved, since they couldn't get us in slavery, they couldn't hold us down with the Jim Crow laws, so they decided to create these felony laws that impact communities that are marginalized. It affects all their freedoms to exist as Black people, people of color, and it affects their ability to live a life free of expression. Whether they choose to be gay, whether they choose to have sex, if they are living with the disease. And I'm at a point now where I really see this for what it is, and it's really not based on fear, and that these communities of people are bringing harm to our society or to our world. This is really based on race. It is really based on enforcing discriminatory laws based on race and people's sex or sexual orientation. That is pretty much what it is. So I'm more interested in supporting those communities, finding ways to build them up so that they can be sustainable into the fight to change laws and to make things better for our society. Because the criminal justice system is not changing. The only way that it's changed is to become more sophisticated in the way that it's continuing to oppress communities. And I think with the times that we're living in right now, I think people are finally coming to understand just how bad the system is against these marginalized communities. So I would want to see more effort to support the work, the leaders that are part of these communities, so that they can continue the fight.
Well, you being part of the work, Robert, I think is certainly going to make a difference, because you are right. This affects certainly Black and brown communities disproportionately, and we know that. And we are experiencing another pandemic, as we mentioned before. And you've seen, right, the correlations drawn already between the stigma around HIV and COVID. How do you think history will judge this moment 2 years from now in relation to both of these viruses? How will it shape our political future in America? Because I really think we are experiencing a movement, not just a moment.
Well, I hope that society will be able to understand or make this, understand the correlation that we're trying to make here with it, HIV and COVID. It is my worst fear that COVID will become part of the criminal code, specifically to COVID, just like HIV had become, years ago, and yet this type of laws never was addressed. There was incentives given to states to address their relationship with HIV transmission. And so they were giving incentives, they were giving monies to do that. And so when that provision ended, it was up to the states to figure out, okay, what we're going to do to address HIV. And so they decided to make criminal codes. And no one in any legislature over the years had decided to go back and review these laws. And so I think for us in the movement, we have an ability now to intervene, to say, no, you're not going to do this. You did this with HIV. We're not going to allow you to do this with COVID. And so I appreciate the Elizabeth Taylor Foundation, and I appreciate those organizations within my community, my HIV community, addressing this together with HIV and COVID, so that we can let the world know that we're not going to let our governments do this again.
I applaud you for your work. Thank you for your voice, always and today, and continue the work. Thank you so much, Robert, for joining us. We really appreciate it.
Thank you, Sonia.
Our next speaker is thank you. Our next speaker is the Executive Director of Community Engagement at Gilead Sciences, Inc., which is the pharmaceutical company behind PrEP and several other medical advances in HIV care. He formerly served as the head of the White House's Office of National AIDS Policy under President Barack Obama and has been a long-time advocate for HIV research and reform. Welcome. Thank you so much for joining us, Doug Brooks. Now, Doug, you've just heard Robert Suttle's incredible story and advocacy, and we know these kinds of accounts, unfortunately, are not new to you. Can you help us understand where the science is today and why this makes Robert's experience really just so much more egregious?
Sure. So first, Robert is such an example of such a courageous human being to share his personal experience of an attempt to dehumanize him, which clearly didn't work because he is such a lovely human being. And these laws are codify discrimination against a certain group of people with a certain disease. And as you said so perfectly, it's not about all communicable diseases, it's about this particular one. And Robert said, and gave us the reasons why, homophobia, racism, and all the stigma. Mm-hmm. And yes, the science is really clear. The CDC, our nation's public health entity, has said that when a person who is HIV positive is on treatment and virally suppressed, HIV sexual transmission is just not going to happen, is preventable. And in our world, we call it undetectable equals untransmittable, U equals U. And the science is not weak by any means. I've said the CDC has cited it, but also it has been cited by the National Institutes of Health, NIH. And while Dr. Fauci has become the most famous doctor maybe in the world to the public, he has been our doctor for a very long time, and someone who we love deeply, and he loves us. And Dr. Fauci actually wrote a piece along with Dr. Diffenbach and Eisenberg in JAMA, in the Journal of American Medical Association, on this U equals U piece, and it's based on very HPTN 052, which was a huge study. I should know the numbers off the top of my head, but it was thousands of people, heterosexual couples, one of whom was HIV positive and one who was not. And it showed definitively that when a person is on treatment and a virally suppressed transmission does not occur. And then that was also further demonstrated in the partner study and the opposites attract study, which were based on male-to-male sexual encounters, and was further proved. So, you know, the science is really clear, and I think that's part of our work, is putting that out into the world and helping people understand the science of it all.
Well, as a leading advocate and someone who served under President Obama in the fight against HIV and AIDS, can you tell us how the current pandemic, COVID-19, relates to the fight against HIV? Because honestly, I see so many parallels between the two, especially the disproportionate effect it's had on Black and brown communities. It's incredible to me, because you see this the systemic racism that is just exposed during both pandemics.
Yeah, you know, as you said earlier, this forum that we're using, this virtual forum, is a little difficult, and now even I'm going to, but early on there was some conversation in the HIV community about making comparisons, and there are people who have felt very strongly that we shouldn't be comparing them. And just to try to get it clear in my head, I actually wrote a piece for myself and said some have argued that to compare COVID-19 to HIV and to the onslaught of HIV is near sacrilegious, that the government and societal responses are incomparable. And I don't try to refute those facts. They are facts. But there are similarities. The initial denial, the fear of each other, the fear of connection, the horrific isolating deaths, the resignation to getting it, the trauma that's been visited upon people, the desire to get back to normal, and as you two were discussing earlier, the late understanding and acknowledgement of the impact on Black lives and the subsequent unequal care and resources. I mean, I think there are some parts of it that we can't compare, and I honor and respect those. But the similarities are also pretty myriad.
Yeah. Well, Gilead is playing an important role in this new fight to reform and modernize HIV laws, and it's such an important fight. Why is this effort important to you personally, and why is it an issue that Gilead is putting its weight behind?
So we're very fortunate at our company to have the opportunity to use our resources to fill gaps, to meet unmet need, and we're able to do things that maybe the government won't do, or other foundations or organizations won't or can't do. And in this case, it's the right thing, and it's an opportunity for us to move toward a more just society. For me personally, you know, I'm a Black gay man living with HIV. I know what hatred and discrimination feel like, and to have an opportunity to work with the women and men who are on this panel, the women and men who are watching this and who are doing the work every day in such a much more important way than I am. But if I get to stand beside them and use the platform that I have the fortune of being on to help advance this work, it's an honor.
And I thank you for your work. I thank you for your work. You've been just an advocate for so long, and we appreciate you. So thank you, Doug. And thank you for joining us, even virtually with all its problems. Our next speaker is the Senior Director of Strategic Initiatives and Evaluations at Transgender Law Center, a health commissioner of San Francisco, and an internationally recognized civil rights leader who advocates for HIV, AIDS awareness and care, LGBTQ equality, and social justice. Welcome, Cecilia Chung. Now, as a transgender woman living with HIV, these are laws. Oh, thank you for joining us. Now, as a transgender woman living with HIV, these are laws that specifically target you and your community. Can you share more about how and why that is?
That's a really great question, Sunny. You mentioned earlier about intersectionality, and I think that this is where it plays a huge part, because like transgender people, especially transgender women, Black and brown transgender women, they are in the intersection of race and gender. And in addition to that, there are a lot of other discriminations and stigma that they have to confront. And so with all those like kind of challenges, it's really easy to see why transgender people of color oftentimes have to resort to like some other like survival economy, such as sex work or other less popular like street economy to survive. And when they become HIV positive, not only did that, further discriminate against them, it also like take away their freedom to make better decisions, because when you have to disclose, that you're HIV positive, like you have to really be prepared to deal with, the rejection. Being transgender is, is hard enough, and so it almost feels like we have to like go through like different challenges and hurdles just to be who we are. In addition to that, when we look at the whole criminal justice system, like what Robert had mentioned earlier, that it is not a equal system for everyone, so Black and brown folks and folks who are transgender usually, are disproportionately impacted by that. And, like we all know that, when you are incarcerated, it's less likely that you are going to get really good health care. Case in point, there is a transgender woman named Roxana Hernandez who was in the ICE detention, who died because of like the lack of health care and attention. And so for us, revising these HIV criminalization law is not only a right thing to do, but it's also a harm reduction approach to make sure that, like we don't just like lock people in cages, but give them the resources they need so they can survive and thrive.
Absolutely. And, you've mentioned Black and brown communities. Are there other communities that you feel are disproportionately affected by these laws?
Yes. So when I talk about Black and brown community, we are talking about that intersection community. For instance, like the migrant community, those who like escape violence from their country to come to this country to like find a better life, to look for a better life, but instead, like they were being criminalized, because they didn't have the paperwork to stay here, or they don't have the paperwork to really access, the healthcare necessary, to help them thrive. And so you would call it double whammy, and I think that, like I call that, like a different, different hurdles. And in addition to that, when we look at the other communities that we talk about, Black and brown trans women who are immigrants, and those who have to like resort to sex work to survive, it's not a very safe environment when there are no other choices for them. And so this is a really vicious circle. And when you look at when they don't have access to good educations, and actually from one of our studies, Positively Trans, that interviewed over 150 trans people of color living with HIV, 80% of them got kicked out by their family before age 18. So this is the kind of like path that they have to get on, and instead of like trying to help them and help them build something meaningful, like we decide to send them to cages to continue to like persecute them.
Wow. Well, your organization is part of the Health Not Prisons collective. Can you share more about that collective and its role in this campaign?
Okay. The Health Not Prisons collective is made up of a coalition of like community-based organizations. most of the leadership in these organizations are all like community organizers. So we built the grassroots movement and also mobilize the community necessary, like to show up and to demand change. And bottom line is, like the more that we can actually engage in these conversations, the more that we can tell our stories, the more that people will start recognizing how irrational it is, to create these kind of laws that criminalize somebody just because they have a health condition.
Now, can you describe the correlation between stigma and HIV laws and what that does to the trans community and really the broader one as well?
Yeah. Yes. So stigma is, it's really that irrational fear, and sometimes, it turns into homophobia, sometimes it turns into transphobia, and sometimes it turns into the kind of anti-Black and anti-brown racisms we see currently, it also, it's trying to point the finger at those who who are living with HIV instead of looking at this as a shared responsibility. With other STDs, people know how to protect themselves. They learn to protect themselves. With COVID-19, we learn to put a face mask on when we go out, and sometimes we use hand sanitizer. This is not just a one-person responsibility. This is, everybody's responsibility. And if we want to really create, a healthier society, we want to make sure that, people really take accountability, for their own health. There are the science now to help prevent HIV, and there are the science now, to live a fuller life, and there are the science now to help people become untransmittable, even when they are living with HIV. So with all these advances, how come we're still stuck with these archaic laws?
It's unreal to me, honestly. Well, given your experience with these laws, what is the pathway to change? How do you envision it?
There are several things that I think, everyone can start thinking about. One is, everyone should get an HIV test. Two, if you are sexually active, consider, getting on the PrEP, which is the pre-exposure prophylaxis. It would help to prevent, someone to get HIV. And then if somebody is HIV positive, we need to encourage them to seek care and be in treatment, because with the proper care and treatment, they can have a long, full life. And, and some of us who've been living with HIV for almost 30 years are testament to that. And bottom line is, we can't just keep sending people in cages. We want to make sure that, we put the resources where it's necessary, create more housing, have better health care, and have better education, and so that, people can have a chance, to live a full life.
Now, I'm sure there are people watching this right now that will watch it in the future. What can audience members do to support change, to support these changes? So there are states who are currently engaging in effort to reform or modernize HIV criminalization laws. And so, look for those organizations and effort, be part of it, or call your Congress representative and state representative to make sure that they really focus on creating laws based on evidence and science and not fear, and really hoping that we can continue to build on that and influence those who we voted for to help us change the world into a better place. Cecilia, thank you so much for your work, your advocacy, and of course for joining us tonight, or today.
Thank you for having me.
Now, we have a final guest. Our final guest is no stranger in the fight to reform HIV laws. He heads up Equality California and is a distinguished lawyer with a very long history of advocacy for LGBTQ civil rights. Welcome, Rick Zieber. And Rick, I have to ask you, am I pronouncing that correctly? Because it's been driving me crazy as I've been reading.
No, it was absolutely perfect, so thank you.
Okay, terrific. Well, Rick, I was saying that this is such a complex issue, and thank you so much for joining us. We heard earlier on the panel Robert's story, Robert Suttle, who spent 6 months in jail really just for being HIV positive. And I hear that you have another example of one of these laws, and I really do think that it will help our audience to better understand this issue if we can tie it to a specific case.
Well, there are a lot of cases sort of out there, and essentially, some of what happens is you actually have folks that are arrested under these laws for circumstances that have no public health threat, where they're not a risk for the public. A key example that happens many times is that you actually have transgender women, often transgender women of color, who are, the old term walking while trans, and they may end up getting arrested for sex work, often when that's not what they're doing. And then because in many cases these HIV crimes extend to increase what might be a minor infraction even for solicitation or sex work, it basically will turn that charge into a felony. And so often you'll have many of these women who are charged with a crime basically because they were arrested and it later turns out that they were HIV positive. They may find a condom in their purse, and then essentially activities that have no impact on the public health are result in people going to prison.
It's criminal for that to happen. I mean, but as we've mentioned, you have a long history in the fight for civil rights for LGBTQ individuals and people living with HIV, including a fight for HIV law reform in California. What tactics were used to get the laws in California modernized?
Well, we really brought together the HIV service providers, many of the civil rights groups, people living with HIV who've been impacted by these laws, and brought together a coalition and started a broad public education program that lasted over several years, and really started advocating with members of the legislature, educating the public, and started an effort really to try to reform these laws in California, which was successful in our passing these laws several years ago. I think California is one of several states that's done this, but I think remains the state that actually now has a model law that eliminated, basically treats HIV the same as we would any other disease. One of the things that's really criminal about this, no pun intended, is that these laws are criminalizing a health status. And I think the COVID pandemic, as you pointed out, and as our guest before pointed out, just shows how crazy these laws are. I mean, why would we don't criminalize health conditions for any other health condition, and frankly, where there are protective laws in place, and we did have some in California, they're not felonies. They're they apply only to extreme sort of cases, but with HIV, in many cases you have a set of laws for HIV that criminalize not even things that result in any kind of public health threat, and then you have laws with respect to every other disease, from the flu to Ebola, that generally will treat things as a public health matter. And so I think the COVID case shows, how crazy would it be if we were basically telling people and families, people that were affected with COVID, that not only do they have to deal with the health impacts of this and actually the heartbreak of potentially having transmission, but on top of that, that they would actually be arrested and go to prison for a health condition. We need to treat HIV as a health condition, and that's what it is.
Yes. Well, what happens next? What states will you, the Elizabeth Taylor AIDS Foundation, and the Health Not Prisons Collective be focusing on now? And what are some of the tactics that will be employed to advocate for change?
Well, there's a number of states that the Elizabeth Taylor AIDS Foundation that we're working with them in partnership on. Some of the states that we'll be looking at will be Ohio, where Equality Ohio has actually started the work of educating the public and is starting to develop a strategy to change those laws there. Missouri is another state. And then, of course, Nevada, where our affiliate, Silver State Equality, will be leading an effort there. The thing that's really interesting is that now we have a real opportunity to change some of these laws. Because of scientific and medical advancements, PrEP, which Cecilia talked about, we have a chance to end HIV in the next 10 years by the end of 2030. But the epidemic cannot end if these laws remain on the books, because they create stigma and they prevent testing. In Nevada, interestingly enough, Senator David Parks, with the help of Silver State Equality and the ACLU and Battle Born Progress, we passed a law in Nevada last year that creates a commission that is actually looking at reforming the HIV criminal laws in the state of Nevada. Our state director for Silver State Equality sits on that task force, and there is the state legislature and the governor has already determined that these laws should be reformed, and we actually have an opportunity to reform them. And so in all of these states, working with our partners, it will be bringing people together that are affected by the laws. We need to center the voices of the people that are affected by this. We know, for example, that members of the Black community and Latinx people are much more likely to be arrested and convicted under these laws. We also know that women are much more likely to be arrested and convicted under these laws. So we need to center those voices as part of the process, and we need to build a coalition, and we need to educate the community about why this is so unfair, how these laws are being used. We have to educate actually gay people, LGBTQ people, gay men in particular. There still is when we were doing some polling in California, we learned that there are many gay men who think these laws protect them. We know that they don't. Essentially, what the laws are doing is it's preventing people from getting tested and getting into treatment. And getting tested and getting into treatment, we know that there are HIV medications now that really will bring viral load down to 0, and it makes it near impossible to transmit the virus. And as Cecilia mentioned, there are preventive medications called PrEP that allow you to basically take a medication, a pill every day, and if you are taking that preventive medication, you can actually it's like near 0 to actually contract HIV, even if you're actually having sexual relations with someone who is not in treatment. So, getting tested and getting into treatment, that's the public health response to this. It's not criminalizing those who are living with HIV.
Absolutely. And you mentioned it just now, but we're seeing these racial disparities play out in our streets and in our hospitals, specifically now around COVID. And the HIV laws that we're talking about today disproportionately affect Black, Indigenous, and people of color. What do you think is the danger moving forward if these laws are not modernized?
Well, I think we're at a bit of an inflection point in our, in our society. We are, we have to, we know that people, Black and Latinx people, people are most impacted by these laws. It's in part because of the health disparities that was talked about earlier, and it's in part because of the fact that we actually have discriminatory criminal justice laws in our country. For example, Black and Latinx Californians, in a study on HIV criminalization before our laws were reformed, made up 2/3 of the people who came into contact with the criminal justice system based on their HIV status, even though just half of people living with HIV or AIDS in California were Black or Latinx. Black women made up 4% of the people diagnosed with HIV in California, and white women 3%, so roughly the same. But Black women made up 21% of the people who had basically come into contact with the criminal justice system related to their HIV status, and white women 15%. So, we know that these laws are not enforced in a way that is, there's discrimination in the enforcement of these laws, and we know that there's basically that communities of color are overly impacted by HIV transmission because of discrimination in the healthcare system, lack of healthcare access, lack of the ability to get into treatment, and lack of access to these preventative drugs. So the combination of higher rates of transmission in communities of color, plus the disparities in enforcement and discriminatory enforcement of our laws, means that there's sort of a double whammy on people living with HIV who are members of communities of color.
This always just infuriates me, honestly. Now I know that everyone here participating in our town hall today will want to understand how they can play a part in helping science and the law connect on this issue. What can individuals do to help create momentum around this campaign? Because I think that's an instrumental part of this.
Well, in partnership with the Elizabeth Taylor Foundation, the Elizabeth Taylor Foundation will be creating educational materials that we'll be distributing and are going to be available through Elizabeth Taylor AIDS Foundation. We're going to be one of their partners. If you're living in Nevada, contact Silver State Equality, which will be working with a coalition that has been formed there to try to reform the HIV criminal laws. If you live in Ohio, contact Equality Ohio. If you live in Missouri, contact Promo, which is an organization there. If you're in other parts of the country, contact Positive Women's Network or Transgender Law Center or Equality California or Lambda Legal. Those are all organizations that have made this a priority. And no matter where you live, Congress is now considering a new law that would basically called the Repeal HIV Discrimination Act, which is being sponsored by Congresswoman Barbara Lee of the San Francisco Bay Area. But it's a bipartisan bill that would modernize these laws and policies at the federal level and provide a step-by-step plan to work with states to modernize their HIV criminal laws. So there's a lot you can do. Contact one of the organizations that's actually in the fight, and call your member of Congress about the federal law. And if you're in one of the states I mentioned, call one of the groups that's working in those states. And if I didn't mention a state, feel free to call Equality California, and we'll put you in touch with folks at your local level that are working on these issues.
Thank you, thank you, thank you so much, Rick. That's what we need, collective action, right? Collective action. Thank you to Rick. Thank you to all of our speakers today. This has been, in my view, a powerful and informative experience, certainly for me and hopefully for our audience as well. My understanding is that we do have some audience questions which we welcome. So before we close, we'd like to take a few minutes to answer those questions. The first one, I believe, comes to us from Eric in California. The question is, given the current climate of the politicization of science and many doubting scientific facts, how do you begin to change the minds of people in government to catch up with the scientific truths regarding HIV and those living with it? And this goes to Doug.
You know, I think often we have to work against systems, and sometimes we even have to dismantle them. But sometimes we need to work with systems. And when I was at the White House, this woman, Catherine Hansons, who runs the Center for HIV Law and Policy out of New York, asked me to convene a forum with the Association of Prosecuting Attorneys and the American Bar Association. And after these, many of these attorneys heard and really understood the science, they made decisions and went back to their jurisdictions and dismissed cases. So it is a time that feels really awful around the politicization of science. And, you know, we talked about him earlier, but God bless Dr. Fauci, who keeps trying to put it out there in front of us. But I do think there are opportunities for us to work with groups and work with organizations who have power and who can make a difference.
Well, thank you for that question. Now, here's another question for Robert that comes from Robert in Texas. I am scared when I disclose my status to a prospective partner for fear of retaliation because I don't know or am aware of what legal rights I have. What are they, if any?
Well, one right you have is you don't have to disclose your status right away. I think it's important to think about what's at stake when before you just choose to disclose, because you don't know what could happen, and I don't want to scare you even more. You know, a person could either be faced with being prosecuted, or they could face death, and there have been instances where someone has died. But I would encourage you to take a deep breath and just consider what will be at stake if you do disclose, because then you can sort of take steps and to think about the best way to be able to disclose your status. And so just understand you have a right to not disclose right away. And I think, and also just get clear understanding as to what things you should disclose and what things you should not have to disclose, because I think there's some discrepancy there that people think they should have to disclose to any and everyone in every situation, every circumstance. According to law, you should disclose prior to engaging in sex. So that is one thing that you should firmly understand, that if you're choosing to engage in sex, that is the time that you should definitely disclose before then. But just in general, if you find yourself in a situation where you should have disclosed and you didn't, just take a deep breath, take a step back, and just try to think of ways that you could perhaps mitigate the harm and perhaps the fear around disclosing, whether it means bringing in a friend or bringing in a doctor or someone to sort of witness you sharing or disclosing your status, because that way, the pressure is not so much on you that it's sort of elevating out or leveling out there, and that person and the power dynamic is hopefully balanced in that situation. But you're right, is you should disclose only when you feel that you have to. And I know there may be people that disagree with that, but again, if they're not a person living with HIV, then they wouldn't possibly understand what you're going through. And then of course there are people living with HIV who may feel a certain way too, depending on what period of time we find our status. But I'm speaking from what reality looks like right now. And you have a right to make sure that you can record or document the instances that you may have either attempted to disclose or when you have disclosed. So that's just a few things that I could think of. I mean, this is pretty much based on one situation to another. There's no just general overall sort of answer to it, but just know that you have a right to disclose only when it's safe for you to do that. And of course, if you continue to have any fear, please feel free to reach out. Please feel free to reach out to myself or to someone that you can trust, and hopefully be able to give you some support and walk you through that process.
Thank you so much, Robert. This next one comes from Michelle in Tennessee. In the state of Tennessee, if you are arrested for being a sex worker, mainly Black or brown trans women, or if you are turned in by a bitter ex-partner and are HIV positive, you are labeled a sex offender and are placed on the sex offender registry. What steps can we make to have these laws reviewed and changed, even in an overly conservative state? This one is for Rick.
Well, I think one of the goals that that many of the organizations that are working on this have is to reform the laws in all of these states, and that is actually one of the ways that the laws have to be reformed. That's the case in many states, that not only do you end up getting a potential risk of going to prison for an underlying crime that has to do with your HIV status, you also then get placed on a sex offender registry. And President Obama, in his when he was in office in 2010, at the Justice Department, recommended that all of these laws be reformed across the country. They were put in place in the 1980s when people were fearful and didn't understand the disease, and they persist today. And in 2014, he recommended that all of these laws be reformed. So, I can say that, a few states have reformed them now. We're working with Elizabeth Taylor Foundation on a handful of them that are coming up. I'm not familiar with where Tennessee is right now, but I think the national strategy is to try to get these reformed in all of these states. If you leave your name with us, we'll be glad to get back to you and sort of put you in touch with folks that are working on these things. The one thing I will say is that this shouldn't be a partisan issue. It's not red or blue. Some of the states that have actually reformed their HIV laws have been states that have been controlled by Republican legislatures or have had Republican governors. And I think the thing that we need to do, and part of the education that we need to make, is that we need to help people understand that HIV is not a health status that is red or blue. It affects everyone, and we need to make sure that people understand that there are people in their families that may be impacted, that they're just how unfair these laws are, criminalizing a health condition. And I have optimism that, especially now in this, in this time where we're so focused on COVID, that we actually have an opportunity to try to take some steps in all of these states that have these antiquated laws and try to reform them.
For the next question, we have a question for Cecilia from Marco in Nevada. And that question is, how does HIV criminalization affect Latinx people specifically?
Well, hello, Marco. And the way that HIV criminalization affect Latinx people, as I mentioned earlier, that like trans Latinx and other Latinx immigrants living with HIV are really severely impacted because number one, there is limited language access. So even though they might want to find out what the law says, they might not have, the language proficiency to do that. Number two is, once you are criminalized, for HIV transmission or non-disclosure, chances are you have to register as a sex offender. And that would severely impact those who might currently have immigrant status and is trying to get naturalized and get their citizenship. And it's even worse, if it's somebody who are coming to this country, escaping violence in their own country, they might not even be able to get any of that. They might not even be able to get asylum because of this. So I think that what we're doing right now is really to like challenge these like irrational laws, and and really like show how dysfunction our current system is, and I think that that's continued to be a questions that we need to like put to our leadership in Congress and in states.
Thank you so much, Cecilia. This next question for Rick, our lawyer on the panel, comes to us from Jason in Mississippi. Now, in Mississippi, we have tried for the last decade, to amend current HIV laws, and it sadly never gets out of committee. For conservative state houses like ours, do you suggest teaming up with other causes, such as breast cancer or Alzheimer's, and merge bills to at least create some type of progress?
I think that's a good strategy. When we reformed these laws in California, even in California, it was over a 4-year effort from the time that we started until we were finally able to get a law passed. We started with the HIV service providers, and the LGBTQ civil rights organizations were the core of our strategy group, but we built a huge coalition that was, I think in the end, by the time we got the law passed, was probably the largest coalition of organizations in the health, civil rights, progressive communities, even the environmental movement. I think we had something like 200 organizations signed support letters to every member of the legislature. We were so I do think that part of this is really to sort of expand your the folks that are supporting this, and making sure that that as many voices are there calling members of the legislature to really help them understand how unfair these things are and how they're impacting people in our communities.
Well, thank you all again so much for joining us today, and to all of our panelists for their time and their dedication to this issue, this very important issue. I've learned so much, and I look forward to staying in this fight with all of you, with our panelists and with our audience. For our wonderful audience, we invite you to help us change these laws, because they have to be changed. Please visit hivisnotacrime-etaf.org or text ETAF to 33777. And please join the movement to modernize HIV laws. I'm joining the movement. And all we need is your voice. And for that, we thank you in advance. Take care.